My name is Alison Hatton and I'm a specialist speech and language therapist in the neurodevelopmental conditions pathway. This video has been produced by the neurodevelopmental conditions team within the Oxfordshire Child and Adolescent Service. This video supports the All Things ADHD post-diagnostic programme for parents. I'm sure these top tips look familiar to you by now, so just take a few minutes to remind yourself of them. So this week's theme is about communication and interacting with your child. In today's session, I will speak for the first half and we'll look at communication and relating this to ADHD. The second half of the session will be presented by my colleague, Dr. Fran Whitaker, who will talk about communication and interaction between you and your child. So the first half of the session, we're going to be taking a brief look at what we mean by communication and the sort of communication differences we see in ADHD, followed by some strategies to support these areas of differences. So I just want to begin just to inform you of the importance of communication and why we're talking about it today. So several studies have shown that as many as 60% of children with ADHD have some kind of language difficulty, which may often go undetected unless their language skills are assessed by a speech and language therapist. So this means possible difficulties with understanding what has been said, the vocabulary that's used, forming sentences correctly, and in particular the use of language, which I'll explain a little bit more about next, and what will be the focus of this presentation. Difficulties in communication can be present even if the overall language abilities are age appropriate. So you think that your child talks fine, but communication is much more than talking. So what do we actually mean by communication, and how and why do we communicate? Being able to listen and understand what is being said and what we say is part of communication. We can break this down a little further. If you can see on the screen, we have the circles that say form, content and use. So the form refers to the grammar that we use, so like word endings, and the syntax is sentence structure and sentence formation. We have the content, which refers to the meaning of words and sentences when they're put together. The use or the function, also known as the pragmatic use of language, is how language is used to have a conversation, socialise and tell stories. It represents all the non-verbal communication that facilitate everyday conversation and broadly includes anything regarding the social use or side of language. It can refer to things like reading facial expressions, talking in different ways depending on the speaker. So talking to the teacher different than you talk to a parent or a peer. It's the gestures, non-literal meaning, being able to understand and use metaphors, irony and sarcasm, and detecting the emotional meaning behind what is said. And this can be done by reading facial expressions and the tone and how things are said. So as you can see, communication is more than words, and we communicate a large amount of how we communicate is non-verbal, with research indicating as much as over 90% being non-verbal, referring to the gestures that we've talked about and facial expressions. We're all hardwired to communicate, so even as babies we're crying. The crying is the communication, which can also be seen as the behaviour, and it's letting us know that the baby wants something. They're trying to communicate something through their behaviour. So the communication or the behaviour is a signal. But what is actually driving the communication of the behaviour? If we think about someone drowning in water, they don't say calmly, "I'm drowning," "over here, I'm drowning." We know from their body and how their body's reacting. So we've got that non-verbal communication. If the child or someone was to walk away from a task, we need to look at why they're walking away from the task and try to unpick it. So the behaviour was walking away, that was their communication. They didn't say it in words, they non-verbally walked away. But we need to figure out, was it too noisy? Was the work too hard? Was it not motivating enough? was the time of the day not appropriate for that sort of attention and ability to complete that task. It's remembering the more anxious and stressed we are and out of control that we feel, this impacts on our ability to communicate effectively. And we can communicate all behaviours, whichever one you want to refer to, by lots of different ways. By looking, crying, smiling, pointing, guiding, hugging, and all the different ones you can see on the screen there, plus much, much more. And we need to be able to communicate in order to greet, to ask questions, apologise, refuse, make plans, have friends, share thoughts, and lots of different reasons why and how we communicate. It might be worth taking a few minutes now and pausing this here to have a think about how your child communicates. Our communication behaviour can be ineffective, resulting in a negative behaviour, or our communication can be effective, resulting in positive behaviour. But what are we seeing on the outside is the behaviour, but what's underpinning that is the language. And the underpinning language is many things, including attention and executive function, which we're going to have a look at and I'll talk about a little bit more in the next couple of slides. So this next slide, we're going to look at communication differences in ADHD. That's mainly, we're going to look at that pragmatic, that use of language, the functional use of language. And even for those with an advanced vocabulary and no specific language concerns, these pragmatic difficulties in communication may still get in the way of social success. So attention, we all know attention is a big difficulty in people with ADHD. Their ability to hyperfocus is very common, but this also means that a person, when they're highly focused, they're completely absorbed in a task and can ignore everything else around them. So people with ADHD can get easily distracted, and particularly by anything visual or noise or even their own thoughts. They can become quickly bored and switch off, which impacts their ability to listen to what has been said. They miss out on important information that can be verbal but also non-verbal, as we've talked about how important that non-verbal communication is as well. Others may think that the person with ADHD is being rude or oppositional when they appear to have intentionally ignored an instruction, despite it's just the fact that they haven't heard. A distracting classroom when multiple activities occur simultaneously is really distracting. People with ADHD find it harder to hold information in mind and manipulate it, so that's their working memory. They may forget what they're going to say or what's been said, which impacts on their ability to understand, despite having the capacity and the ability to do so. This can be the same when reading. If we look at processing and memory and organisation, in ADHD you may see a slower processing speed because they process language differently. More likely to go off topic, struggle to find the right words and put their thoughts together in an organised fashion. This may result in them repeating words or using fillers such as as they're trying to organise their thoughts and give themselves more processing time, and that can appear as if the young person's got a stammer. They may struggle to find the right word and what they want to say, and that's known as word finding difficulties. In order to retrieve a word from our memory store, we have a filing system, and we want everything in our filing system in our head to be organised correctly. And if they're organised, the words are organised in nice categories, we can find the words easy. But sometimes if that filing system isn't organised enough, it can be difficult to retrieve that word when we want it. and the person with ADHD might end up saying something that they don't mean. And that's when we might think that someone's speaking without thinking as well. So there's differences in social communication. The ability to retain focus on a single speaker and to transition between speakers is challenging. This has social implications, leading some children with ADHD to find it easier to get along on a one-to-one basis rather than a group where there's lots of different people. Conversation partners may become impatient if someone is taking their time to get their message across succinctly and to organise their thoughts. The person with ADHD may be less aware of the perspective of the other person, so may talk more about themselves. Children with ADHD often talk quite quickly and with an increased volume. And these differences are largely linked to problems with executive functions, which affect people with ADHD and ASD. And you can see on the right hand side, we've got attention, listening, processing, working memory and organisation. And those difficulties with executive function will have result in the behaviour we see on the left. So we want your child to be using effective communication or behaviour strategies. So it might take some time to have a look and observe any ineffective behaviour communication that they're currently showing, so that we can start to kind of make an action plan on how we can support that ineffective communication. This is a nice quote off Facebook by How To Dad. And it says, ADHD isn't something in your child that needs to be fixed. It's a superpower they just need to be taught how to use. And that's what we want to look at next, some of the strategies that we could use to support your child. So we're first going to look at environmental strategies, so things that can be just done on a daily basis that can have a big difference. Telling your child to just listen does not really help. So what is being able to listen? So being able to listen encompasses lots of things. It can be hearing, looking, understanding, being able to attend and filter out all different sorts of noises. So being able to listen is not as simple as being telling someone to listen. We can support people's attention by reducing distractions and background noise where possible. It may be easier to talk in smaller groups, so there's less people talking and to try and focus on and filter out. So ask your child what they can hear. They might be able to hear a noise that you've not noticed or thought about, or they might find something visual quite distracting in their environment. A very busy kind of visual environment can really distract a person. We live in a time with increased visual and digital world, and there's been lots of research out there about the use of screen times and the effect on our attention. So it's worth kind of reducing screen time, turning off the TV, not having it on in the background, and trying to have some quiet time. Getting the young person's attention before talking to them. This may be by calling their name or giving them a light touch. Allowing the child to use something to fiddle with and allow them to have movement breaks. Maybe carrying something with a bit of a weight can help as well. Educate others of what works for your child. So what works for one child won't necessarily work for another. So by educating the teachers and people in their everyday environment of what they need and what environmental strategies they can take place will make a real difference. Your child might be able to tell you that sitting against a wall helps, or sitting close to the teacher, or sitting at the back. We can't necessarily assume where the best place to sit in a classroom is for them. Surround your child with good role models and be a role model yourself. So you need to model the expected and that wanted behaviour, that wanted effective communication. So show them good listening skills. If I've been in classrooms where teaching assistants have talked over the teacher, and that's not modelling good listening and attention skills. When appropriate, define the task, make this a specific endpoint so the young person knows exactly how long it's going to take and when it's going to finish. Teach your child what to do when they have not understood and when to ask for help. You can model this yourself as well by asking someone to repeat things when you have not understood. And model and talk about it being okay not to understand, and there's times where all of us don't understand something. A supportive environment encompasses visual support. Visual strategies and things that are visual is something we look at in order to help us. Many children understand what they see better than what they hear, yet we tend to communicate largely through talking. We as adults use visual strategies on a daily basis, such as calendars, diaries, writing things down, putting things on post-it notes. And there are symbols that we rely on every day, such as road signs or the symbols on male and female toilets. So visual supports help us to listen and attend. They are permanent, so they help our memory, and they help children be independent and not keep asking the same question. So you might get fed up of your child saying, what time are we doing? Are we having lunch? What time are we going out? How long will it be until I can go on my Xbox? So having it written down on a timetable that you can signpost the young person to will really help with their independence, their narrative skills, so being able to understand time concepts and what will happen next and before. It supports transitions and tolerance of any change and routines. This automatically reduces stress and the child's anxiety. Helps them to organise as well, so you can have lists and visual support of what they need to put in their bag before school, and so they have a bit of a checklist of what they need to be taking on certain days and what subjects are on certain days. Children with ADHD tend to live more in the here and now, so having something that's concrete that they can refer to instantly helps them know what is happening now, but also to help them prepare for the tasks that come next. And we can also use visual supports to help us understand and teach emotions. There's also specific language strategies we can use. Even if our language is age appropriate, we still have times when our emotions are heightened that our ability to use and understand language is reduced. So it's important to keep language simple and say what you mean to avoid misunderstandings. Slowing your own talking down is a good way of encouraging others to do the same. So it's known that telling someone to slow their talking down isn't very effective, but if we model it ourselves, then the person we're with will hopefully pick up on that and do the same. Allowing pauses and processing time, so additional processing time. If you repeat an instruction or something you've said, try not to reword it. By rewording it, that person is having to start processing all the information over again. They may have only missed a bit of what you said, so if you say it in the same way, they're more likely to get it the second time. Give instructions in the order that you want them done, so give them in chronological order. So instead of saying go and get your bag after you stop playing that game, and make sure you put that cup in the dishwasher before you go upstairs. That's it might only be asking to do 3 things, but the order and the amount of language used is quite confusing. So instead, say it in the order you want it done. So put your bag away, go upstairs, get your coat, come downstairs. So anything in the order that you want them done. Model the actions and behaviours you expect to see yourself and make sure that expectations are clear. Prepare in advance for any changes and talk through possible different scenarios and discuss that there can be more than one right way. And we've talked about allowing additional processing and thinking time. And that's providing that your child or young person doesn't become anxious. You may want to model thinking time yourself by scratching your head or thinking out loud. Reduce the amount of language that you use so it's less to process. Too much language and choice can increase stress. And finally, we're going to look at social skills strategies. So for example, if you've identified the difficulty of interrupting, then you might initially want to start by making sure you increase your child's awareness of this. So you might jot down how many times they've interrupted in a certain amount of time, and then you need to make sure you explain the reason why you want to work on this as a social skill. For example, how it might make the other person feel and the impact it will have on friendships. And then you can decide a goal together of how you want to reduce them interrupting and maybe talking about themselves too much. You want to practice and rehearse this, and it might be worth thinking about giving them a script. And when we talk about scripts, we talk about maybe some phrases or some language that they can use that's going to help them out in those situations. For example, they might practice saying, "I'm sorry to interrupt." They might want to ask the communication partner, the person they're speaking to give them more time so that they can organise their thoughts. They might tell the person that they're speaking to that they apologise if they go off topic or they say something that they don't mean, because sometimes they say the first thing that comes into their head without actually meaning what they're saying. You can maybe organise and decide on a signal. So if your child is interrupting, but also if they go off topic, so you could have different signals, practicing one skill at a time or a few, you can decide that between you. There's many books and resources out there to support social skills, and Michelle Gracia has got quite a few, and they're books that help talk and explain about social interaction and awareness with some ideas and resources of how to work on those. And one of her books is called Thinking About You, Thinking About Me, that you might want to have a look at or maybe borrow from a library. And finally, just to say thank you for listening, and my colleague Dr. Fran Whitaker is going to talk to you next.
Hi, my name's Dr. Fran Whitaker. I'm one of the CAMHS consultant psychiatrists in the Oxfordshire CAMHS NDC team. Thank you to Alison for the first part of the presentation, looking at the communication needs that people with ADHD might have and how to support those. In the second part of the presentation, I'm going to be looking at effective communication skills more generally, so how we all communicate with one another regardless of whether we have ADHD or not. In families, I think we tend to see both the best and the worst of each other, and this can include in regards to how we communicate. So most families could probably benefit from improved communication skills, but it might be particularly helpful if communication is also made more difficult due to ADHD. Over the next 15 to 20 minutes, we're going to look at some tips for improving communication. And these tips are all taken from the Incredible Years book, which I'm going to give more details about on the next slide. The Incredible Years book is one that we often recommend, full of really helpful parenting strategies for all children, including those with ADHD. And in particular, relevant to this presentation, there is a chapter on effective communication skills, and there are other chapters on areas like problem solving, which are also really useful. So I would recommend getting a copy of this if you can. So I've divided the tips that we're going to look at today into 6 main headings. So they're active listening, speaking up, calling a truce, editing what we say, making positive requests, and talking about feelings. So the first of the 6 areas that we are going to look at is active listening. When we hear the word communication, we tend to think about what we say, but listening is actually just as important, if not more so. For the Q&A session, it would be helpful if you can just try and think of some times when your child seems to find it easier to talk with you, when they feel they have your full attention, for example, and just make a note of that so that we can have a bit of a discussion. Active listening is a real skill, and it's something that we can all get better at. Some tips for demonstrating that we're listening include giving good eye contact, allowing the speakers to finish talking before we start asking questions or making suggestions, listening to what the person is saying but also how they're saying it, so paying attention to the non-verbal communication as well as what is actually being said, asking questions once the person has finished speaking to show that we're interested and that we've been listening, and also summarising what we've heard to check that we have understood correctly. We talk about validating a lot, and what we mean by validating is trying our hardest to show that we can see the problem from the other person's point of view, even if we don't actually agree with that point of view. As another conversation starter for the Q&A session, if you can, jot down a time that you really felt listened to yourself, and just have a little think about what that was like and what it was that made you feel really listened to. Alternatively, you could think of a time that you felt you really weren't listened to, and just jot down a few ideas about how that felt, and again what it was that made you feel that you weren't being listened to. The second of the 6 areas that we're going to look at is called speaking up, and what we mean by that is making sure that we are expressing what we're feeling and thinking to other people. So that can be really important to make sure that other people aren't trying to second guess what we might be thinking and making decisions for us because we haven't said what we want. It can also prevent having a sudden explosion of feelings because we've been trying to keep a lid on them for so long. So on this slide we have some tips for speaking up, and on the next slide we have an example to demonstrate what we mean by these tips. So first of all, it's really important to use the word I rather than you when we're making statements to somebody else about what we're thinking and feeling. So saying I focuses on our own thoughts and feelings, whereas saying you often suggests blame and criticism of the other person, and that will often lead to an argument rather than a constructive conversation. It's also helpful to be brief, clear and specific with what we're saying, so trying to focus on the issue at hand rather than bringing up lots of previous arguments, for example. It's also good to avoid comments that make big generalisations, so those comments like you always do this or you never do this, they can often be unhelpful. So saying what we want positively, briefly and respectfully, and thinking about how we want help solving a particular problem rather than bringing up lots of past arguments. So here we have an example of how somebody might raise an issue with their partner, and we have to begin with an unedited version of what they might say, and then we have another version having thought through those tips from the previous slide. So as I'm reading them out, maybe just have a think about how you would react to hearing the 2 statements. So the first is, I've had enough of you always nagging at me from the moment I walk in the door. You don't understand how much pressure I'm under at work, and you never even ask how my day was. And then the second is, I have a lot on my mind when I first get home at the end of the day, and I would really appreciate 10 minutes to myself before I start helping with the kids and the chores. So we have some final tips for speaking up. On the one hand, it is important to express negative feelings that we have, and to do this promptly rather than letting things build up. But it's also important to be thoughtful about what we share. So being sensitive about where, when, and how we express ourselves. For example, trying not to overshare what we're thinking and feeling with our children. It's also good to check in with ourselves and think, am I just in a bad mood today, or am I really interested in solving something before we have a conversation? And thinking about whether it's the right time to have a difficult conversation, or whether we could talk more constructively at another time. The third of our 6 tips is calling a truce. So if a discussion with your family is becoming unhelpful and turning into an argument, then your family can call a truce. So you should agree ahead of time how that could be signalled. Anyone in the family might say something like, I need to stop talking about this now, or I'm getting upset, can we stop and talk about this later when we're all feeling a bit calmer? It should be agreed that even if only one person feels this way, that everyone respects that you will call a truce. And we'd also suggest that the calling off period shouldn't be longer than, say, a day, because otherwise it might be tempting to never finish having that difficult conversation. So the fourth of our 6 tips is learning to edit what we say using polite and positive communication. And this involves, first of all, focusing on what you can do rather than what you can't. The example we have here is a child says to their dad, "Dad, can we go to the park?" And Dad says, "Why are you asking me to go to the park again now? We've just spent the whole morning playing together. I have loads to do. Not everything is about you." So quite a critical response to his child's request, and focusing on what they can't do and why they can't do it. An alternative could be that Dad says instead, "I've got a few chores to do, then in an hour we can go to the park. Why don't you play in the garden while you wait for me?" So he's focused on what they can do and making a plan, and also gives his child an idea of what they could do while they wait for him. Another part of editing what we say can include focusing on the positive and editing out complaints. So for example, if your child's helped make dinner, which is something you're really pleased about, but they've made a big mess in the kitchen, on this occasion it's probably best to show gratitude for the effort that they've made making the dinner, and save those concerns about the mess they've made for another time. A third edit, which might be less obvious in some ways, is editing out self-criticism. So our children learn a huge amount from watching and copying us. So in order to help build up their self-esteem, it can be really helpful to make sure that we're trying to show good self-esteem ourselves. So for example, if you've lost your temper with your child and you think you need to apologise, it's really important to remain kind to yourself in the way that you do that. So something that you could say might be along the lines of, "I shouldn't have shouted at you like that. I'm sorry. How can I make things better?" Rather than becoming very hard on yourself and saying something like, "I'm so sorry, I'm such a terrible parent." So the fifth area that we're going to look at is giving positive requests and commands. So looking at how to effectively give commands or make requests from others, especially children. And you'll probably notice that there's quite an overlap with the tips here compared to previous slides. So first of all, being positive, something we've mentioned before, saying what you do want instead of what you don't want. So an example might be, instead of saying to your child, "Stop making a mess," you might say, "Please put your plate in the dishwasher." So making it really clear what behaviour you want to see and asking for that in a positive way. It's also important to be specific. So instead of saying, don't be late again, asking, please make sure you are ready to leave by 8 AM. So again, being really clear about what you want. As I've mentioned on previous slides, using the word I is good. So I would like you to sit at the table while you eat your dinner, please, instead of, for example, why will you never eat your dinner sitting down? If we're asking questions, using words like how and what can be more helpful than the word why. So what would help remind you to put the rubbish out instead of why didn't you put the rubbish out again this morning? And that's because why tends to focus on what has already happened and can lead to arguments, whereas using words like what would help remind you to put the rubbish out can help focus more on problem solving. One of the most important things that I'll say throughout this whole presentation is make sure that whenever you do see the behaviour that you want, you're giving praise or reward to your child. So for example, giving them a hug and saying, thank you so much for being ready on time this morning, that really helped me. The more that you show your appreciation and that you're noticing all the things that your child is doing to try and please you, the more they're going to be motivated to keep doing those things. So the last area that we're going to look at is talking about feelings. Parents can help teach children to start identifying their feelings and putting them into words by talking openly about their own feelings in a calm way. So the first example, a parent says to their child, I really enjoyed going to the park with you today, that made me feel happy. So in this example, the parent is sharing what makes them feel happy, and in particular, doing something together with their child brings those happy feelings. In the second example, a parent says, I feel sad that we can't see Grandma this weekend. I'm looking forward to meeting up with her again soon. So this parent is demonstrating that it's okay to feel sad about things, and they're also helping their child think about how you might deal with sad feelings by looking to the future and what you can do in the future. When it comes to sharing negative feelings and areas of conflict, the aim is to calmly share these with your child and to think about what action can be taken, so whether there's any problem solving that can be done rather than venting or blaming. So an example might be saying something like, it made me cross when our neighbours played loud music late yesterday evening. When I'm feeling a bit calmer, I'll go over and have a chat with them. I'll explain that you and your sister were already in bed and it woke you up. So in this example, the parent is demonstrating that it's okay to feel angry about things, and they make it very clear what it was that made them angry, but they also go on to showing how you might deal with that conflict in a calm way. So another way parents can help children with feelings is by trying to verbalise their children's feelings and validating them. So for example, saying something like, you seem upset after arguing with your friend, is that right? Would you like to sit down when we get home and think about how you two can work things out? So in this example, the parent is showing that they can see their child is upset and checking in with their child about whether they've got that right or not and whether they've identified the right emotion. They're showing that it's okay to feel that way, and then they're moving on to thinking about whether any problem solving can be done. So we've looked at 6 areas today related to communication skills. We've looked at active listening, speaking up, calling a truce, editing what we say, making positive requests, and talking about feelings. So please just remember that good communication is really difficult. We've given several examples today of the ideal ways of phrasing certain things, but obviously none of us manage to always phrase things the way that we want or get it right all the time. Communication is a skill that we can all practice and get better at. So thank you so much for listening to our presentation. If you've had any questions or thoughts during either part of the presentation, so the section where Alison was looking at communication difficulties in ADHD and support for those, or the second part of the presentation looking at communication skills more generally, do jot down any thoughts or questions and bring them to the Q&A session, and we look forward to meeting you then.